let me turn to Nathalie Jean Baptiste. She is the Deputy CEO of the Julius Baer Foundation. And before she joined the foundation, she was a Marie Curie Global Fellow. She led an action research unit in East Africa and worked for 15 years in research and project implementation. I think she's really passionate for the topic of health equity. She would like to produce solutions to urban vulnerabilities and to lead a positive transformation in the Global South. Last year, she facilitated a module on wealth inequality, social mobility, and health. Nathalie, we are very excited that you share with us what are the challenges and opportunities for health equity at the global scale. Also for you, 15 minutes, I will give you a sign when the last 2 minutes are come. Thank you so much.
So good morning, everyone. Thank you for, first of all, for the invitation. It's always great to be here. As I was preparing the talk, and I've noticed in my desktop that there is Lugano 21, summer school, Lugano 22, 23, and now we are 2024. And it's also a privilege to follow Antoine, because I've mentioned to him yesterday that it's a great learning opportunity for me who comes from the philanthropy side to in your learnings and your experiences and ideas actually inform the work that we do. And it's a great opportunity to have this exchange with you today. I'm gonna shift gear a little bit. And if you will allow me, I'll take the 15 minutes that I have to give you a sense of why wealth inequality is extremely important if the goal is to achieve health equity, and why we need to understand it, understand how it works, and what are the makings, the mechanisms, the modality to actually try to reduce it. So I want to begin by giving you an outlook of global inequality. Some of you may already know this map that you see on the top left. It shows the top 10% national income share. So we've been doing this work for a few years already, alongside scholars that look at wealth inequality. And what we know is that the gap between the ones who have a lot and the ones who don't is actually increasing in the last 20 years. The map you see shows basically the top 10%, when you see that is marked in dark red, is the territory where you have the top 10% share of wealth, and that is about 52 to 65% of the wealth. So the top 10% richest person in these regions hold about 52 to 65% of the wealth. This is bad enough, but when you look at wealth, this was income wealth, but when you look at wealth inequality, the gap is even wider. And this is the graph you have on the bottom. What it shows you, it's that 50% of the global population owns about 2% of the global wealth. And the 10% of the global population hold about 76% of the wealth. Now, what does that mean when it comes to addressing wealth equity? And the distinction that I make between wealth and income is important because wealth is actually more fundamental than income. When we talk about wealth, we talk about assets, financial, non-financial assets, as well as privilege, network, and power that one accumulates over time. And when we look at the health aspect, understanding global wealth inequality, and that is more pronounced, what it did, it gives us a sense of considering what does that mean for intergenerational health disparity. And we're going to talk about this in a while. Now, I'm insisting on the topic because this is what I do day in, day out, of course, but also because I think it's important to address with you today what are the important aspects of it? What are the implications? So we know in our studies that in places where you have a high wealth inequality, it leads to productivity slowdowns. It's actually really bad for the economy. We also know that in places where you have high wealth inequality, the capacity of households to sustain sudden shock is really diminished, and we saw it with the COVID pandemic. We know also that the capacity of the state is also diminished because the state doesn't have this mobile capital to be able to invest again in the social infrastructure that the people need. And lastly, we've seen it in the latest political account happening even in Europe, that high level of inequality also allows different extreme ideas to emerge in society. So there's risk of populism, and there's also the risk that disadvantaged groups can exert less pressure to change the policies that also will be in their favor. So all these aspects are particularly important. Now, in my work, I see a lot of projects, proposals, ideas, research, and some of them are actually related to alleviating poverty. And I make a point always to show the difference between addressing inequality and addressing poverty. Inequality is relational. That means it's a relation between individual and individual, a group of individual, institution, countries, in which the interaction, the flow, generates greater advantage for one group and less advantage for another. The measures to address inequality often look at the unequal distribution of resources, of power. And while the measures to address poverty are actually look at tackling access to basic needs. So these are two different problems, and we need two different types of solutions to address this. In health, and to achieve health equity, we need not only to deploy specific strategies that address the multiple determinant of health, and we heard them just right now with Antoine's presentation, but also we need to address the unequal distribution of resources. Now, this is where I bring you another idea, the idea of social mobility. This is a complex idea. You can go up in the social ladder and you can go down. So there's upward mobility and there's downward mobility. But basically, in a nutshell, it's based on the transition from one situation to another. Social mobility encapsulates the changes in the workplace, in education, in the housing situation, and also in healthcare. And the modern society, social mobility is relevant to having a sense of advancement in society. And some research say that social mobility can also affect happiness. However, the ideas are polarized about social mobility. There are those that maintain that it's not enough, and those that maintain that it is the tool through education, through social infrastructure, through housing, to reduce inequality. I have a tendency to agree on that because I see it in my own circumstances. I always say I'm the personification of social mobility. The likelihood of somebody from Haiti to stand here and discuss with you is very low, actually. But I also agree with those that claim that social mobility is less effective, and the best way to address it is actually to tackle it at the core, to reorient economy, the work conditions for the one of the bottom 50. Now, the two ideas are not wrong. Actually, it takes a myriad of ideas to address the inequalities in health. And we know the correlations. We know, because you're all expert in this, we know that there is a correlation between economy and the life expectancy. We know that life expectancy of people in high-income countries is higher. We have a project in Sao Paulo, and I know in regions, in neighborhoods in Sao Paulo, the richest have 14 years of better or longer life than the ones in poor settlements. And the symptoms of inequality troubles everyone. And that's what Wilkinson and Pickett in their work have said many, many years, for almost 20 years when they published their very iconic book with Kate Pickett. So across the board, and here, it doesn't matter if you come from a more disadvantaged low-income country or high-income country. Across the board, you have problems of health, mental health, violence, addiction. So these are all known. But I'd like to introduce another idea. And this is a little bit more complex. We already know that there are power imbalance between high and low income countries. But the way in which this affects progress towards, Antoine just mentioned it, universal health coverage is extremely important. And this is what we need to start tackling. And there's another issue. There's an idea of forum shifting, the influence of big actors to propose different types of forum where decisions are made that meet the needs of certain actors can also affect the authority of larger multilateral organizations to ensure global health security and drive a more equitable agenda for all of us. Now, this is my last slide because I wanted to be quick. I'm sure I'm under the clock right now, but I want to leave space for a conversation with you. Now, this one is tricky because I can't help but being vague in this slide, but we can have a conversation with later about that. It takes multidimensional intervention to achieve this. We know there is also an issue with data. We need better data, accurate data, to be able to make decisions. We know that certain governments need to have decisive leadership at macro level to push their agenda and to recognize what is their priority, regardless the economic push that they have. We know that we need better collaboration among actors, and that's why this interesting multidisciplinary scene now, it's so important to have the conversation about how we can affect or address the problem at micro level. We also think that doubling down on the wealth gap, but at particular instances, so for instance, coverage among women, children, newborn, can actually increase the possibility of achieving health equity over time. And finally, and this is where also an organization like myself can be very active, it's convening the different thinkers, decision makers, and enablers under the premise that, and maybe I'll leave you with an idea, with a much positive idea, on the premise that actually achieving health equity is achievable. It's a choice. And we all here, I hope we can start debating about how to be more intentional about it. So I leave you with this. Thank you.